Well, new data has found more than 8,000 people could return to the workforce if financially vulnerable Australians had access to the National Hearing Services program. Joining me now live is Hearing Care Industry Association Acting Chair Janet Muir. Janet, good afternoon. Thank you so much for your time.
Good afternoon.
Firstly, can you take us through how many people in Australia do suffer with hearing loss?
So with the recently commissioned research that we did to raise awareness around hearing for World Hearing Week, which is this week, there's actually now, per the research in 2020, 3.9 million Australians suffering from hearing loss. Our most recent research before this was 2017, and that recorded 3.6 million. So just in 3 years, we've had a rise of 350,000 Australians more now suffering from hearing loss.
That is a massive rise. Yeah. What sort of a hit would that take to the economy, I guess? What is the financial loss of that?
Yeah, so according to the research, currently there's an economic cost, financial cost to the Australian government of $20 billion.
Now, there's currently a hearing services program. Can you take us through what that is and what the criteria is for those who do have hearing problems?
So for those that actually do have a hearing loss, we have a fantastic world-class hearing services program, but predominantly the hearing services program focuses and is only eligible for predominantly those over the age of 65. Something that the hearing services program is not available to are those that are currently of working age. And those suffering from hearing loss in the working age environment, it sort of restricts them to be able to either enter the employment workforce, it may affect them within the work environment, and it may even inhibit them with working opportunities. So whilst at the moment, great service program, the hearing services program for the elderly, what it's not extended to and what we wanted to raise awareness with some of the research was around those between the age of 26 and 64 who have a hearing loss but just don't have the financial means to be able to seek support and access devices or treatment to help them.
Have you put the case forward to government about trying to extend the HSP to people who are on a lower income in that age bracket that you mentioned?
Yeah, so the Hearing Care Industry Association that I'm part of and representing here today for many years has actually advocated this position for those within that working age on low income. What was fantastic, and we acknowledge the government, in their 2018 Hearing Health Roadmap, they actually endorsed those people in the working age, lower income, that it was one of their key priorities to look at. And so then by this week, HCIA commissioned the research with Deloitte Access Economics, and we put this week with a parliamentary breakfast, we announced the research and put that towards the government, and it was really well received. So we're looking forward to working with the government to actually possibly implement some of the initiatives that we identified from the research.
Janet, is hearing loss at all preventable?
It is better if we raise awareness around hearing loss, and there's many ways that hearing loss can happen. It's over age, it will occur, but there is actually industrial deafness as well. So that would, for example, be a case where it could be prevented. So again, part of hearing awareness is about us raising awareness about what you can do to prevent potential hearing loss, but as we age, it's higher, more likely that we will experience hearing loss over time, but best treated early. And so we really encourage those people from 60 years onwards, definitely, to get an annual hearing health checkup.
Some great advice and certainly an important conversation to have. Hearing Care Industry Association Acting Chair Janet Muir, thank you so much for your time this afternoon.
Terrific. Thank you.